Facebook. I'm Erie Times-News online reporter Sarah Grabsky. We are here today at the Erie Times-News. I am with our health reporter, David Bruce. Hello, David.
Hello, Sarah. How are you doing?
I'm well. We are discussing the UPMC Highmark consent decree. We've had a load of questions on this. We should tell you guys that there will be a special section on this exact topic that is running on Sunday, right, David?
On Sunday, it will explain some of the history of it, which we'll get into in a little bit here on Facebook Live. Also, what it means to the folks in northwestern Pennsylvania, which is quite a bit for a lot of the folks who either have Highmark insurance or UPMC health plan insurance, regardless of where they get it.
So we're going to touch on, hopefully answer some of your questions today. If you have questions that are specific to you, David and I will do the best that we can to address them. I've got iPad, phone here, so feel free to chime in as we are kind of discussing. But we are just going to basically talk about the 101, what you need to know. David has been reporting the last few weeks, or I guess just uncovering some of the information that he'll be reporting, or that he wrote for the section that is this Sunday. So, David, let's talk about let's go back to when this all began.
True. This really goes back to about 2011. The main players are Highmark and UPMC. Highmark in 2011 and still is the largest private health insurer in Western Pennsylvania, and UPMC is the largest health system in Pennsylvania. And in 2011, the two were in negotiations for a new provider contract whereby UPMC hospitals and physicians throughout Western Pennsylvania would be in Highmark's network, that people with Highmark insurance would be able to see those physicians, go to those hospitals, and be covered at the highest coverage rate that you could get. What happened at that time is the other health system in Pittsburgh, the West Penn Allegheny Health System, was having severe financial difficulties. In fact, there was real danger that health system might go under, and that would leave the city of Pittsburgh, in fact, the whole Pittsburgh area, with basically one health system, UPMC. Depending on who you talk to, Highmark or UPMC, the point where this all really got started was the fact that Highmark bought the West Penn Allegheny Health System. Highmark says they needed to do that to ensure that there was competition in the health system between in Pittsburgh between UPMC and non-UPMC providers. What happened as a result is that the negotiations for the provider contract basically stagnated. Highmark bought the system because they felt UPMC needed competition, and UPMC decided they didn't want to have a new contract with Highmark because now Highmark was a competitor because they had bought a health system.
Right.
And so the contract, the provider's contract, was going to end in 2012, I believe the end of 2012. And so there was a dilemma. What happened at that time is that then Governor Tom Corbett got involved and got the two sides to agree to extend the provider's contract until June 30th, 2014. So then coverage for folks with Highmark insurance, they could continue going to UPMC hospitals, UPMC physicians, and be covered at the highest rate. They were in-network rates through then. During that time, in 2013, Erie kind of got more involved in this because St. Vincent Hospital ended up being purchased by Highmark and joined its new Allegheny Health System. It became one of the hospitals in Highmark's Allegheny Health System. So now this argument, this battle between Highmark and UPMC became more and more relevant to here to the folks in Erie.
Right.
To make a long story short, because the history of this, even though it only goes back to 2011, it is a very complex history. State officials got involved again, worried that there was going to be a whole lot of people in Western Pennsylvania without health coverage or without affordable health coverage. They were able to convince Highmark and UPMC reach these consent decrees that we're talking about. And technically they are two consent decrees. We call it a consent decree, but there were two separate ones that were signed. But they are basically 5-year consent decrees. For 5 years, UPMC and Highmark agreed that for many of the non-Pittsburgh UPMC hospitals, including UPMC Hammett, that folks with Highmark insurance would still have in-network rates. They would still have the highest level of coverage going to these UPMC hospitals and these UPMC physicians. Now, those consent decrees are set to expire June 30th of next year.
Of 2019.
Of 2019. And contrary to some rumors we've heard over the last year or so, there is no indication that these consent decrees are going to be extended. Folks from both Highmark and UPMC have told me directly that they are 100% believing that these consent decrees will expire on June 30th of next year, meaning that for almost all folks with Highmark insurance, UPMC will be out of network as of that date.
So this is the dilemma that we're in, is
Yes.
that especially right now, a lot of people are choosing their health care coverage and they're wondering, what do you do for 2019 for the upcoming year? So tell me a little bit, and we just ran a story, it's been probably a few weeks ago, but tell me what employers are doing. How are they choosing their plans?
Sure. There are many ways folks get insurance, as many of you know. Two of the most common ways that folks purchase insurance are if they are of working age or if they are retired but under the age of 65. Most of them get their insurance from their employer. Some buy it on their own, but many get it from their employer. So the employers are the ones having to decide, what plan are we going to offer our employees for 2019? Now the renewal date for employers isn't always January 1st, doesn't always start their calendar year, but for a lot of them they do. So right now they are shopping for insurance coverage for 2019. They have to take the consent decree into consideration, because if they say, let's say they pick a Highmark plan and their employees all have Hammett docs, they will have in-network coverage in June, but they won't in July. So it's now time is of the essence. Most of these employers are having to decide which plan to choose, or do they go with another insurer other than Highmark or UPMC. A few, mostly larger employers, are offering both insurances. They are offering what they call side-by-sides or slices. They are actually offering to their employees, the employees get to choose whether they want Highmark or whether they want UPMC health plan. But again, this seems to be a small percentage of employers out there in northwestern Pennsylvania are being able to do this choice, and mostly it is folks with more than 100 covered lives.
So have you talked to officials from Hammett and from Highmark? I mean, how are they preparing? How is everyone preparing for this? How is our healthcare field preparing for this?
Well, in different ways.
Okay.
Let's talk with the hospitals themselves. Hammett, which is part of UPMC Hammett, and St. Vincent, which is part of Highmark's Allegheny Health Network, are preparing for this by building massive projects. Both hospitals are in the process of building expansions to their hospitals in excess of $100 million. St. Vincent is building a $115 million extension that will house their new state-of-the-art emergency department as well as new operating room suites. Hammett is just started construction of a new 7-story patient tower that's going to be $111 million, which will include, I believe, 60 intensive care unit beds, their new diagnostic unit, or part of their new diagnostic unit, and it's going to have room for other things. In fact, they were considering putting their cancer center in there. They recently decided not to, and we'll get into that a little bit later about the cancer centers, because this all plays a role as well. So both hospitals are expanding. In addition, well, we can get into it now, both hospitals are going to be opening their own cancer centers. They've agreed to dissolve the Regional Cancer Center, which they jointly opened back in 1987. Vincent, in addition to building its huge expansion at the hospital itself, Kitty Corner at 25th and Myrtle, they are building a large cancer center, whereas Hammett is going to take over the RCC building on West 12th Street by the Yorktown Center, and that's where they're going to have their cancer center once the RCC is dissolved.
Okay, real quick, I'm sure that we have questions, but can we?
Sure.
Sorry, folks, our iPad's not working, so David is kindly lent me his phone so that I can see if you guys have questions. In the meantime, David, let's continue to talk about cancer coverage. People who are going to be needing that, especially in 2019. True. What do they do?
Well, and part of this is, so right now, almost all cancer treatment, and when we're talking about radiology and physician visits, people are still going to the RCC. I mean, some folks go out of town, especially if they have a rare cancer, but when it comes to your radiology treatment, you're still going to the RCC. For 2019, that will continue, but you will have to, it will depend on your insurance where you go for chemotherapy, because right now chemotherapy is being done at the hospitals themselves and has been done for more than a year at Hammett itself and at Vincent, so they will need to know about their insurance going into that.
And I guess what makes this a lot tricky for a lot of people is that it is until June 30th. So what if you do choose a Highmark plan? Are you going to have to switch providers, or like what is the? And
that's the main dilemma that folks are having to face here, is that, okay, so for a lot of folks who get their insurance through their employer, unless their employer offers a side-by-side or a sliced plan where they offer both Highmark and UPMC, or their employer offers one of the other health insurers, Aetna, Cigna, or United Healthcare, they're going to have to abide by the networks that their insurance is from. So if their employer is offering for 2019, they offer, let's say it's Highmark, they are going to have physicians who are in Highmark's provider network, or pay massive amounts of money out of pocket. They're going to have to pay money out of pocket to go see the doctors if they are UPMC doctors, unless they're getting emergency care. So if, let's say, someone has Highmark insurance now, and they have some Hammett doctors, they are going to have to switch their doctors. If they can't switch their insurance, they're going to have to switch the doctors. And the same goes for if they have UPMC health plan, but they have some St. Vincent physicians, or they go see St. Vincent for some of their hospital visits are at St. Vincent, they are going to have to switch. Both Hammett and Vincent have set up, they have phone lines. I know St. Vincent has had meet Dr. Wright events to meet with physicians. They are trying to do their best to make it easy and convenient for folks to switch their doctors. Talking with some of the patients here in northwestern Pennsylvania, it may be easier, but we're talking about with some patients who have seen I talked to a lady that I'll detail her and her family's issues in Sunday Stories. She's had the same primary care doc for 20 some years, and she's going to have to switch. She has started the switch. Her entire family's going to have to switch physicians. It's not easy. It's not a pleasant experience to go through in many parts, and many times, because you have these relationships.
And this goes, another thing that maybe a lot of people don't realize is that pretty much all doctors are affiliated one way or the other, correct? So like things you don't think about, like ear, nose, and throat specialist or something like that.
Well, that's one of the exceptions here. That's one of the,
there we go. I hit the nail on the head there.
So what has happened over the last 10 years is that, and people probably know this pretty well, there was a time where very few physicians were employed by the hospitals.
Right.
Most of them were their own business. The doctor or doctors ran the practice. That has changed over the last 10 years. Vincent, through Allegheny Health Network, Hammett through UPMC, and Mill Creek Community Hospital through LeCom Health have been hiring more physicians, buying more practices, so that now a vast majority of the physicians, both primary care, family docs, and other specialists are hospital-owned. Two of the practices that are big, first of all, dermatologists are mostly still independent. But the two main practices in town, we nailed down about two practices in town that are still independent, are ENT Associates, the ear, nose, and throat specialists in Erie. They are still independent, and one of the biggest OBGYN practice, OBGYN Associates of Erie, they are also still independent. They both of those practices have, you can go to any of the hospitals when you have those physicians. Most of the others are employed by the hospitals, and you will only have access to their, through a certain, if it's a Hammett practice, you'll have to have non-Highmark health coverage, and if it's a Vincent practice, you'll have to have non-UPMC health plan coverage.
Which is why we're kind of harping on this now, because the choices that you make, you might get big bills in July if you don't, choose to switch now. And it's people like your child's pediatrician who you might, not think, we're going to the ER or something like that, is affiliated with one of the two hospitals.
Though there is also a pediatric practice that's affiliated with Children's Hospital of Pittsburgh, and those with Highmark coverage will still have access to that practice here in Erie through, I believe, 2022. Children's is one of the few UPMC hospitals that is not affected in 2019 by the consent decree ending. It's also Western Psych Hospital, and then also some of the rural hospitals like UPMC Northwest in Venango County, UPMC Horizon in Mercer County. Those will also still be in network because they are deemed rural hospitals where there is not another medical provider within a short distance.
One of the questions that we had that came in was, and you kind of touched on this at first, David, but why did the insurance companies choose to go this route, or I guess it would be Highmark, choose to go this route?
Well, and this is where interviewing folks from Highmark and interviewing folks from UPMC, you get slightly different answers on this. Highmark officials have said they bought the West Penn Allegheny Health System to ensure that there was competition in the Pittsburgh area. They were adamant that they did not want to see Pittsburgh become a one health system town. They were very concerned, as they said, that UPMC's medical costs would rise significantly if they were the only health system in town. They said those rates were already starting to go up. That is the main reason why they did that. UPMC, on the other hand, has had UPMC Health Plan for years, I believe a decade or more, and some of their reasons for creating a health insurance are very much the same. They viewed Highmark as the 800-pound gorilla in Western Pennsylvania as far as health insurance is concerned, and that's why they started a plan to have some competition on the health insurance side. So it's kind of interesting, the mirror of each organization, how they don't want the other one to be a monopoly in Western PA.
Now, if you don't get health insurance through your employer, and you just wrote about this as well, what are the other options? Go over. It's Medicare?
Well, if you're 65, you're eligible for Medicare. Medicare covers about 80% of your medical costs. So many folks who have Medicare and earn too much money to qualify for Medicaid, many of them buy either a Medicare Advantage plan, which is kind of a wraparound plan that is that private health insurers, including Highmark and UPMC Health Plan, offer, or they get a Medigap plan, which kind of just fills in the blanks of the Medicare plan. If they choose a Medigap plan, which is not quite as popular in our area as Medicare Advantage, those are not affected by the consent decree. You can have a Highmark Medigap plan and still go to UPMC hospitals. But there are other issues of having Medigap plan, which is why Medicare Advantage plans are more popular. Those are affected by the consent decree. So folks, and this is also the open enrollment period for these plans for folks on Medicare, they also have to keep in mind that if they choose a Highmark Medicare Advantage plan, they will not have access to most UPMC hospitals after June 30th, and those who choose a UPMC Health Plan Medicare Advantage plan will not have access to St. Vincent and most of the other hospitals in the Allegheny Health Network after June 30th. So they have to keep that in mind as well.
So what are some of the other things that you've written about in relation to this for Sunday's paper? What are some of the other?
The main thing is to know, what can you do? Folks want to know, well, what can I do to prepare for this? And so the first step is, it depends on if you have a choice in what your insurance is going to be for 2019. If you have a choice, let's say you buy your plan through what everyone calls Obamacare, the Affordable Care Act. You go onto the healthcare.gov website and you choose your plan for 2019. Enrollment for that starts on Thursday. What you'd want to do, if you control whether you buy it through healthcare.gov, through Obamacare, whether you buy it directly from a Highmark or UPMC Health Plan or Aetna or whoever, or if you buy it through an insurance broker, one of the folks whose job is to sell insurance to individual and small companies in town, you want to know who your doctors are with, and that plays a role in what plan you pick. So keep that in mind. Keep the consent decree and its effects in mind when you choose your health insurance for 2019. Now, for a majority of people, like the folks here at the Erie Times-News, who their employer offers you your insurance, this is your plan for 2019. Then you have to take a look at your doctors. Who are they affiliated with? You know, and if they are going to be out of network after June 30th, and you have to take this insurance because it's the only one that's offered, you then have to start the process of switching your physicians. And even you can start now, or you can start, you know, the first half of next year, but you should try to have everything in place well before June 30th. Both, and I'm going to put on my glasses here because there are numbers, and if you want to jot these down, and these will be in the paper on Sunday. If you want to call and get some information about how you can switch your doctors, if you want to call the Allegheny Health Network, if you are looking at switching from UPMC doctors to Allegheny Health doctors, it is area code 412, so it's a long distance call, 412-DOCTORS, D-O-C-T-O-R-S. I don't have the numbers written down for that, but it's 412-DOCTORS. And on the flip side, if you're going to have UPMC Health Plan insurance for 2019, and you want UPMC docs, and you currently have Vincent docs, you want to call 1-800-533-UPMC, and that will both Highmark and UPMC also have websites where you can find docs. So they have really tried to make it as easy because this has already happened in Pittsburgh. They've been under this for a couple of years. The latest agreement that the two had reached involved most hospitals outside of Pittsburgh, including up here in Erie. So they've already kind of gone through this. There's already been some structure made for folks to switch their docs.
And a lot of people have kind of speculated. There was another question that was about somebody thinking, and I think that this kind of gets a little bit confusing because when you're out and about in the community, you might see something like this, but she said, are the hospitals nonprofit? Like, is this somehow profit-based, I guess, is the question.
Well, they're nonprofit. I mean, because you're nonprofit doesn't mean you can't make money. It's what you do with the money.
Right.
They're not allowed to use the money to line people's pockets. They have to use the money for the operation of the business or set it aside for future operations of the business. So this is not about making the hospitals richer. As I said, I've been reporting this for years.
Right.
It is what they both say is neither one wants the other one to be a monopoly. UPMC did not want Highmark to be a monopoly in insurance, and Highmark did not want UPMC to be a monopoly in healthcare. Mm-hmm. And that's kind of where this has stemmed from, is that these two healthcare giants are been battling for 7-8 years, longer in some ways, but this has really grown in the last 7 years.
And I mean, you've been on the health beat for so long. Have you ever seen anything that's been like this, in your experience where?
Well, no, I mean, people have had issues with Highmark being a dominant insurer for years. If you remember, and some folks may remember, a long time ago, Hammett and Vincent got together with a local businessman and created a health insurance plan. And for the life of me, I can't remember the name of it right now. But eventually it got sold to Health America. But they were so concerned about Highmark's dominance in the community that Hammett and Vincent got together and created a health insurance plan. It never got, it got some folks, in fact, it got the employees of the hospitals had that insurance for a while.
Right.
But it was, so there's been issues with that all along. But what we've seen is, we had two independent hospitals not so long ago in Vincent and Hammett. They are both now part of two larger systems, and so what we have seen are the problems that start in Pittsburgh sometimes come to Erie.
Right. Is any other? I mean, are there any other areas of the country that are dealing with this? Right, are going to be dealing with this kind of in the magnitude that we are?
I don't know if there are or not, to be honest. I would be surprised if there's not some.
Yeah.
Area of the country that has to deal with this. Speaking about the area, there's one aspect we haven't talked about. I want to talk about is, and we've gotten several questions on this, is what happens if you have a Blue Cross Blue Shield plan
yes.
that's not Highmark. Highmark is the licensee for Blue Cross Blue Shield for Western Pennsylvania. You go over to Ohio, it's Anthem. It's not Highmark. You go up to Buffalo, it's Blue Cross Blue Shield of Western New York. So what happens if let's say you have your insurance, you live in Erie, but you work over in Ashtabula and your insurance is Anthem? Well, this is something that we've just been getting the last few days. Unless UPMC has a contract with that specific Blue Cross Blue Shield provider, which they are in the process of having a contract with Blue Cross Blue Shield of Western New York, unless they have a contract with that specific Blue Cross Blue Shield provider, they will also be out of network, just like in the Highmark. And that's where you stand for that. I want to make one thing though. One of the other questions folks have had is what happens if I'm traveling, like someone travels
right. here.
This is not for emergency care. If you have an emergency problem, you are a trauma victim. Let's say you have Highmark insurance and you're a bad car accident here in Erie, and you're not able to sit, you need trauma care. Well, Hammett is the one trauma center in town. You will be taken to Hammett. You will be treated for emergency treatment. You will be covered until you are properly assessed and your condition is stabilized. At that time, once your condition is stabilized, you will then be transferred to an in-network hospital. That might be Vincent, it might be Allegheny General down in Pittsburgh, but you will be treated and covered at Hammett, even if you have Highmark insurance, for emergency care until you are stabilized.
That's a good
right.
point, too, because I think a lot of people have it in their minds that they're never going to be able to go to UPMC Hammett again if they have
right.
Highmark insurance. Which
they are for emergency care, but at what point is it no longer emergency
yes.
care? It's the way it's explained is once your condition is stabilized. So.
Okay. All right, David. We'll tell people if they have any questions. I mean, what's here to come? Like, how do they?
Sure. Well, we will explain this in greater detail in the package of stories we have on Sunday.
Yeah.
I will have a list of phone numbers that folks can call. One of the best ones for folks who are looking at Medicare plans, whether you're looking at Medicare Advantage or Medigap plans. So if you have Medicare and you're looking at buying one of these plans and you need some counseling, you need some help, some guiding through this, GCAC has an excellent program. It's called the Apprise program. And the number for them, I'm going to put my glasses on again, it is 459-4581, and you put in extension 494, and you can make an appointment with a Apprise counselor who can help you pick a plan so that your docs are going to be in network. Now again, those are for folks who are looking at Medicare Advantage plans or Medigap plans. Again, that is 459-4581. And then once again, 'll give the numbers for the two hospitals you can give calls to. If you're looking to switch doctors, you need information on docs. Vincent is 412-DOCTORS, DOCTORS, and UPMC is 1-800-533-UPMC. And again, those are the numbers to call. And you also have those websites. You just Google Hammett, Find a Doctor, or St. Vincent, Find a Doctor. You'll find the websites that can also help you out with that.
So we hope this has been a little bit informative, David. I'm going to run back and turn the camera off, so it might be a little bit of a weird exit, but of course, you know, we're always here if people have questions. David Bruce is here to help all the time, so.
She's very kind. But again, the big thing is to be prepared. You know, find out who if you're getting your insurance through your employer, find out who your employer has their insurance with for 2019. If you are picking a plan, you can look for help, whether you're looking for a Medicare Advantage plan or if you're picking your own plan and you're under 65 and you don't have Medicare, whether you're going online or whether you're working with a broker. Know who your doctors are. Your best thing, your good first step is know who your doctors are affiliated with, whether they are Hammett, whether they are Vincent, whether they are Lacom Health, or whether they are independent.
All right. Thanks so much, David, and thank you guys for joining us. We will see you later.